Right, so it is 7:31 on April 17th, and so the Board of Health meeting here in Fairfield is called to order. From the minutes from our last meeting, I don't know if everybody had a chance to review them, but if there are any additions or corrections, otherwise, is there a motion to approve the minutes?
So moved.
Second.
All in favor?
Aye.
Any opposed? No, so the minutes are passed, so we can move on to...
Hi, I'm just joining, so I'm a couple minutes late.
That's all right, Mary Frances. All right.
Thanks.
Just started.
Great.
Okay.
So we can move on to the director's report.
Okay, sure. So regarding the budget, so the budget has now made it past the Board of Selectmen, now made it past the Board of Finance, and tomorrow Jill and I go and present to the RTM tomorrow night. And, hopefully we will, be able to adequately answer, address their questions, and the final vote for that will be in May, early May, usually the first week in May or so. But we continue to work on that. So the 2 part-time positions that are in there are still in there. So hopefully that'll continue. The state did announce a few large grants that are available to local health departments. And so there's a what's called the CDC immunization grant, which provides for us about for us, we're eligible for $143,000 in funding, which is for promoting vaccination and providing vaccination availability. About the unique thing about this one is of the 143, 51,000 of it has to go towards media outreach. And so we'll have a big sort of media outreach campaign we'll have to figure out, what exactly we'll spend that on. There's been some talk of doing that regionally, where we'll pool the money and, maybe do some high quality PSAs and things like that. And I know in the past they've done billboards and where those things are very expensive and can eat up a lot of money. But so we're sort of taking that around. They've announced the grants. They haven't given us the request for proposals yet, so we don't know the specifics of what they will allow in its entirety. But this grant will go from September of 23 to June of 25. So a little over a year and a half to spend that money. The other big announcement was the Public Health Workforce Development Grant. For Fairfield, that'll be a total of $152,000. And that is to be used till November 30th, 27. So it's for the state, it's a 5-year grant. By the time they get it to us, it's probably going to be more like a 4-year grant. And we will plan to apply for that. And so it's given the dollar amount, it'll probably end up being a part-time person. And we'll try to stretch that out over the whole entire grant period, with a full-time person and the benefits package that's required here, it would wipe it out in a year or a quarter or so, a year and a half. So we plan to apply for that. We've submitted, the internal town process of we have to fill out what's called a grant application request, which we've done, and that's been approved by the CFO and the first selectwoman. And so now we're just waiting on the actual grant applications to come out, and then we can proceed with that. And then we have to go before since these are larger grants, we have to go before the Board of Selectmen, the Board of Finance, and the RTM again. Just like the budget process, we have to get those approvals. So we'll start that process, and hopefully can do that before if the applications come out quick enough, we can do that before the summer break and have it in place for the September start date for the vaccination grant. So that's the hope. And then they've changed. So we get annually what's called the Preventative Health and Health Services Block Grant for the past forever, though, as long as I've been here, 27 years now. Every health department receives a small grant from the state that is used for every couple of years. They change the focus of it. What we've been using it for recently, and for us it's about $15,000 a year, is we've been dedicating that money to the pedestrian and bike committee. And so our Santina, our assistant director, goes to those meetings, and they decide what environmental improvement, what's the right term I'm thinking of? Infrastructure improvements to make. And so things like they've added sidewalks and the bike lanes and the striping on the roads for bike routes and signage, and all those little improvements that have been happening over the year through the Bike Pedestrian Committee have all been funded by that grant. So what they're moving away from the sort of automatic funding, and now they're moving to a request for proposals process. So it'll be a competitive type of grant process, which is good and bad. A lot of it will then end up going to the large cities, most likely. But we've been a good partner to the state. A couple of our projects have gotten federal recognition, and have been featured by the state, saying, "Hey, look what our grant did." Here in Connecticut, ultimately it's CDC money coming down to the state and down to us, and so and the state on numerous occasions have called us to say, "Hey, we've got extra money. Do you guys have a project in the pipeline?" And we always have a list of projects, so they say, "Yeah, sure, no problem." So we'll get 10, 15, 7,000. Different years they'll say, "Okay, we've got this much for you," and so we always take advantage of it. So I think we'll be able to submit a favorable application, and hopefully we'll be able to compete with that. But did somebody just join us?
Yeah, sorry to interrupt. It's Sally. I was on my way there, but I just had a work issue I had to deal with, so I'm calling in. Is that okay? If you need quorum, I don't know if this counts or if I should go there. I don't mind.
We have a quorum, and we're
okay.
Halfway through the meeting. So
okay, sorry about that.
Thanks, Sally.
But here I am.
Yeah,
Thank you.
So just tonight, I literally saw it just before I walked in here. The state released the RFPs, and it's only going to be about 20 awards in the entire state. So they're sort of looking at larger projects. So we'll see. We'll have to read through that and see what the requirements are, but we'll probably submit an application for that, and hopefully we'll be successful. So the COVID testing site, we were notified that they have closed the site, and they are in the process now of decommissioning the site. And so we've had a few meetings with them to look at the infrastructure that they put in and see what will be left there for the town. So some of the electrical infrastructure, they put in a bigger service to the lot, a couple additional telephone poles, and so that may benefit the town to keep that there for things like electric car chargers and other things like that. And so, and even some of the rec department is looking at some of they've constructed the almost like guardhouses there for the check-in, and so they might use those to replace some of the ones they have down at the town beaches, and even the drive-through canopy structure. They may try to if they can find a good use for it, so that it's something that's usable to the town. They may look at taking some of that infrastructure. So they're working those details out, but Yale is looking to sort of decommission the site quickly and get it all wrapped up by early May. In addition, this week we have the Department of Public Health Commissioner and Deputy Commissioner coming down this Friday to meet with our department. So they've been doing a sort of meet and greet tour and have a little agenda, and Mark will be there, and the First Selectman will be there. and we'll meet with them. It's about a 2.5-hour meeting where they'll come in and we'll meet the staff and do some introductions, and then we'll review they'll do a tour of the department, and then they have a series of questions that they like to ask that we'll go through with them. But from other health departments that have gone through it already said it's all very friendly and, they're not trying to, get you, and, sometimes when I was in New Haven, we used to get lead poisoning audits. So they would take our lead poisoning cases and open the files and make sure that you're doing everything right, and it was always a stressful time. But, so from what I've told, it's a much friendlier visit. And then this week we will actually have a Girl Scouts and Government Day this Wednesday. And so we have 2 girls that are going to be doing a tour with 2 of our sanitarians. So they'll be taking them to some restaurants and doing a septic system inspection and visiting nursing and doing a couple of things in the field. And then they enjoy a lunch together down at, well, I guess it's not at Penfield. It's usually at Penfield, but we'll see. It's somewhere this year.
I don't know.
But so that's really my entire report. We've been working on continue to work on the FDA food code. I mean, it's a big lift for our inspectors. Just it slows things down. The inspections take longer, and it's a new form, and trying to figure out, okay, this used to be a 7, but now it's a this over here, and they have to kind of. It's a similar process, it's just done in a different way, and so we continue to plug through that and working through that change. We're just about to probably another week working on the code changes that we approved and posting a new version of the public health code that is up to date. We realized that the one that's up there now has a few things that we had approved before that we didn't include. So we'll be updating that in the coming week or so. But yep, that is it for me.
Great. Thank you very much.
Sure.
Yeah, how do you anticipate the FDA changes, affecting how you publicize to the public, or put out to the public, kind of the status of establishments? Now we see, they failed at sport of so-and-so, they rectified this, they open back up, or they haven't, whatever. Is it going to change that communication to the public at all?
Yes, in the sense that, everybody will have to move away from the sense of pass and fail. It's simply, there's 3 classifications of violations. The more serious ones have to be corrected very quickly, and then the serious ones are, within 2 weeks, and then the routine ones are more, like a standard correction period, 90 days, to correct. So I think that communication will change. What we're hoping to move to with the new database, and I've shared a couple times that we're transitioning to a new database, that people can just go on and see the actual inspection form, and so that whether it's a reporter or whether it's the public, you want to see how a restaurant does, you can read the inspection report and see exactly what they got marked for. And, and hopefully we're hoping the database will reflect this, and we think it will, and how quickly they corrected it, and, whether it's corrected on site, and the FDA code allows for, the previous code allowed for things to be corrected on site. Obviously, if you could correct something right there, they would do it. But the FDA, but it wasn't sort of spelled out in code. The FDA code allows you to correct on site and mark it as corrected on site, and so that it's, if that's the only thing that you had to go back and check, you don't have to go back and check that because they corrected it. So it's this clear definition of like, oh, yep, they made a mistake, they corrected on site, it's done, and you can kind of move on. And so we're hoping that, there'll be a transition time till that new database goes live, but that the hope is that within a year or so we'll have the public-facing side of that database, where people can just go in and say, like any restaurant they want, and say, all right, here's the scores for and here's the actual copy of the inspection form and the comments that the inspector made and the correction history, and that's, we think, is the best way. We always tell people, just come in and read the inspection reports, and when we get the calls from the reporters, same thing, we say, well, we'll give you the whole report, like the debit sheet and the comments and and the follow-up inspections related to that, and And usually that provides a clear explanation. We thought the articles that have been in the paper in the last, year and a half, I mean, they were on, before COVID, they were doing it, and then they stopped, and then they resumed again. But that they were always fairly representing the restaurants, and and they would talk with the restaurants to get their side of the story, and I thought the articles were fair in that respect.
And those databases are updated very quickly, so that if people go on, if there's a correction that's made, it'll reflect in the.
Yeah, so the hope is that, that this is a live database. So as soon as that inspector signs off and I imagine hits submit on that inspection form, it's in there minutes after, and that, that those, so, but, we're still learning that, we're still in the planning phase for that database, so.
Interesting, great.
Okay.
Jill, the nursing report?
Yeah, just a few things. As usual, we have a staffing update. That always happens. One of our long-term nurses handed in her resignation. Yeah, she'll be gone in a couple of weeks, actually. And as a result, it was kind of a desirable position. It was over at Tomlinson, and there are always 2 nurses over there. So there's been a lot of jockeying and up to that, and a few lateral moves among our full-time staff. So we haven't actually gone outside yet to hire anybody, but I've been interviewing them. And we have a list of some really good candidates. In the meantime, I had 2 part-time nurses resign. One of those were filled, and we're interviewing for the other part-time position. So it's nothing that I really was surprised by or wasn't expected. At the end of the year, you usually have this sort of thing. We are having, it's tight. I will say that. We have a couple of nurses who are going to be on maternity leave, like starting tomorrow and again in the fall. But we think that we have enough sub coverage to take care of those 2 positions. So we're doing okay. In February, it was to celebrate Heart Health Month. We had the program manager from Emergency Preparedness from Yale New Haven and the coordinator of the EMS service up there come down and review with us the newer AEDs that are in FPS right now. They weren't new. They've been in there since September, and, no one actually touches the AED. You just kind of go by, the battery is working okay. But we were able to get a trainer, and he came down, and we had our mannequins out. And it wasn't our regular CPR recertification, but it was just trying to get people more familiar with the incorporating the AED and CPR. So that worked out really well.
So that's the nursing staff and the teachers, or just nursing?
No, just the nursing staff, yeah. It was just at a staff meeting. We do have, we did back in the end of January, we had a number of teachers get their CPR certification over at the fire training school. So that worked out well too. We always want more. A lot of the coaching staff, they are CPR certified, and of course that ends up being a teacher, gym teacher, whatever, that we want to grab those people to have them on our emergency response teams in the schools.
Are they available on all the fields?
I'm sorry, the AEDs? Not on the field.
Not on the field.
No, they're usually, in the high schools, there's one close to the nurse's office, and then there's another down by the athletic office.
Okay.
They're not cheap.
Mm-hmm.
The trainer may have a portable one that she always carries around with her, but I'm not aware of that really.
Curious.
I thought that may have been in the works, but I don't know.
Sorry to distract from your report, but as a committee, are we able to enact public health code that requires all teachers to be CPR and AED trained? So this way, it's such a relatively easy skill and easy to obtain. Can we enact a code as a?
Well, we do have requirements for an emergency response team in every school, and we go through training, twice a year actually, and people do sign up for that. We have adequate teams. I will say, if you have too many people, sometimes that gets in the way of things. So they do their review, and everybody has their roles that everybody goes through. And now with this AED trainer, which we haven't had before, we're actually able to incorporate that in some of the emergency drills.
I guess I just think back to the sad story in Hartford just the other day with that poor little boy there on the playground, right? He was on the ground, you know, not alive for up to 10 minutes. Well,
Oh, I didn't hear that.
Yeah. Hartford, East Hartford, I think it was Hartford. They thought he was playing dead
yeah.
at recess, and he was just dead. Until someone finally went and checked
How
on him
old
and
was
realized.
the child?
Elementary school.
Elementary school.
Yeah,
Oh, my word.
yeah.
Well, I guess, you know, has the Board of Ed considered
I haven't heard anything about it.
anything like that? I mean, typically, historically, the Board of Health doesn't set policy or make, you know, can make recommendations to the Board of Ed, but the Board of Ed is the elected body to govern the school system, and so we would turn to them to say,
Right.
you know.
I was under the impression that my children do have long QT, so every time the nurse gets the form before school starts, I get the phone call
Yeah.
saying, oh, like, have there been episodes, have there been whatnot, because they just want to make sure that the teachers that they have are trained in
Yeah.
using the AED, and I was like, no, there's never been an episode, but I was under the impression that the teachers did have some sort of certification or training on the AED. Like, I thought that they
They
did.
can.
Oh, but
can.
I didn't know it was voluntary.
Yeah,
I thought
it's
it was
voluntary.
interesting. Okay.
Yeah.
Something I can, I don't want to.
Are your children attend Fairfield Public
Yep.
Schools? Did they ever attend one of the private schools in town?
They did. Some of them did.
Okay.
Yep. What?
Oh, because I think at that school, it was a bit more extensive. I don't
Oh,
know
no,
if it
because
was you to tell you the
I feel
truth.
like it was, at Ludlow Middle.
Oh, okay.
I got a phone call saying, hey, just making sure that I don't need to know anything. And it might have even been Sherman, too. I think, people see long
Oh,
QT
okay.
on the thing and they kind of freak out.
Yeah.
So.
No need to, right?
Yeah. So, the conversation I had with the nurse, I was under the impression that, like, oh, I'll just make sure that the teachers that they're with
Yeah.
are comfortable with how to use it.
On the other hand, I mean, the AED, the beauty of it is that, you know, you don't need intensive training on it.
Right.
You know, it's like, you go get it and,
Right.
you know, you just
tells you what to
listen.
Follow the yeah.
Just follow the directions.
Interesting.
But it's the incorporation that we found that we were missing, incorporating CPR and the AED use to make it a little bit more seamless.
Sure, yeah, I mean, it's not intuitive, you know, I mean, it's
Yeah.
someone that's never done it before, it's quite frightening, you know?
Yeah.
Yeah.
I think the most important thing is that people know where it's located.
Right.
You are absolutely, I used to work at Tomlinson,
Mhm.
and I was going over, you know, at the beginning of the year, where all the, and I was saying that the AED is in the vestibule. Of course, no one knew what a vestibule was.
Right.
And then I realized that the parking lot for this, they never come through the front door. The parking lot was in the back of the building.
Mhm.
So they never went where the, you know, in the front hall right there
Mhm.
is the AED, and they had no clue what I was talking about. So that's a good thing.
That highfalutin vocabulary of yours.
Yeah. They were looking at me like, what are you talking about? So, yeah, I actually should find out, well, I mean, they have it because the nurses all have to say in their in their substitute reference sheets, you know, when the sub nurse comes
mhm.
on, who's on the emergency team, who's CPR certified, who is, you know, has extra training and whatever. And that all has to be indicated on that. So we can get that information, exactly how many. But a lot of times I found that people want to volunteer,
Mhm.
and if they don't attend all of the drills and all that, it can be more of a mess than
Mhm.
it needs to be.
I guess just as a parent, I mean, I would assume that every teacher would be CPR trained, it's not that hard to do, you know, and
Mhm.
Yeah.
in my mind, it seems sort of intuitive that they would be, you know?
Yeah.
So it's kind of surprising to hear they're not, and I get that there's, you know, union issues and all that there to making that happen, but certainly from the school board side, something to,
Yeah.
you know, maybe look
It
into.
was, and back in January, I guess we had a couple of professional development, early dismissal days, and so we were able to set it up at the fire training school if they could do it that way. You're right. I mean, paying for people to go attend the training is always a consideration.
Sure, yeah, I mean, I'm part of an organization where we actually like Stop the Bleed training for some school districts in New York, and every teacher had to come through and do the training, and it was just part of the requirement, CPR and Stop the Bleed, and they just had to do it.
Yeah.
Sorry, to take away from you there, but.
That's okay. So I want to talk about immunization requirement update. As I'm sure you all know, the religious exemption was eliminated just about 2 years ago now, in 2021, so that every child who's in kindergarten now can no longer claim a religious exemption. Those who are currently in first grade through 12, if they've had one, they can grandfather that in as they go along. As other students from other districts transferring into Fairfield, if they've had a religious exemption on file, that's valid. But if they're coming from out of state, it's no longer valid. So we ended up, particularly with COVID and nobody could get a doctor's appointment, we had a number of students who were not compliant with their vaccinations. And we were told when the religious exemption went away, and it wasn't specified at the state, just how much time, what kind of a schedule they had to be on. People were allowed to make up their own schedules. They could have vaccine a month, a vaccine every 2 months, and significantly behind. We've had a number of kids who have transferred at older grades during the pandemic from New York. New York only required one hepatitis A, for example. Connecticut requires 2. So we have a number of students who really need, that push to get on it. Well, back in January, the commissioner, and it was frustrating to work with that because these kids were not vaccinated. And, we've had a few cases of, at least chickenpox or shingles in the schools, and, a lot of notification has to go out. The commissioner said that effective immediately, we had to comply with the CDC catch-up schedule, and within 30 days of when the vaccine was due. So we went through everybody in the schools to find out what the vaccination status, and I was concerned because I really felt that the numbers were going to be low. But surprisingly, they weren't. We have schools right now that are 100% compliant with all the students in the school. There are a number of others that I think, from my feeling and seeing what their vaccine history is, that they just need the opportunity or the reminder to go to their primary care and get it, or come to us and get it. We're going to be offering that. We do have a few students who clearly were never vaccinated, and it's difficult for them to do the catch-up. In April here, they could certainly all be vaccinated by the time school rolls around in August. So we're going to be working on that. We don't know. Sans, I spoke to you about that, and we were thinking about, what are the consequences for people who don't get their vaccination. So we're working it through.
Is there like a drop-dead deadline, like it's like the first day of school?
First day of school.
First day of school.
Yeah.
And we don't have...
To be completed or to have started?
Well, some of them could be, particularly the younger ones, could be in process. You have a Hep A, let's say they get it in July, their number 1 shot, and then their number 2 shot's not due for another 6 months. I've spoken to the superintendent about it. He's certainly behind whatever, we need to get in there. We used to, and, we still do, exclude students. Let's say going into 7th grade, they don't have their meningitis and their adolescent DTaP. We would exclude them until they get it, and then they just come down to the health department and get their shots. And so we have to think about that, whether or not, that would be I'm not for excluding children from school, but I'm also definitely for children being vaccinated. So that's the big push that we're going to have this summer. It'll be a challenge.
Do we know if other neighboring towns have similar numbers, or?
We were always, you can look the numbers up. It's on the state DPH website. And Fairfield was always pretty good, with an exception perhaps of a few private schools in town. And they would claim religious exemption, and that would show up in our numbers. Anecdotally, I haven't looked at their numbers, but talking to other supervisors, yeah, it's comparable.
Okay.
Yeah.
And getting records, most people have their records from early on childhood vaccinations from their pediatrician. Everybody has, that's all recorded.
Well, it's great, Mark. We now have access to CTWiz, which is the statewide database for vaccinations. And I was looking up a few kids that I was going to give a call to. And, you don't even have to talk to the parent. As a school nurse, we have access to the CTWiz database. It's all there. Right. And just download all that information. Some of the kids got vaccinated over April break, which is terrific. Great.
Good. Yeah. One of the benefits of COVID is they've sort of made that more and more available.
Oh, yeah. Every school nurse has access to it. What's that?
Probably long overdue.
Oh, yeah. Oh, yeah. I was looking at one today, they're coming from overseas, a child transferring, and they have a similar database in another English-speaking country in Europe, and I could not understand their database for the life of me. Did they get it, or are you just recommending that they get it? So, CTWiz is really quite good. So let's see, what else? We also had a surprise visit from DPH for relicensing of our Well Child Clinic. I don't know if I even told you that.
Yeah,
Oh,
you did.
okay, sorry. Of course, those were all suspended during COVID. They were not going out. They were not making any site visits or anything. So we kept up with all of our paperwork and all that. And she came down for about 3 hours just going through everything in the clinic, and the next day we got our approval. So that's good because we certainly do a lot down there. Review of policies and procedures. I just want to warn you, we're really currently reviewing and revising several policies related to diabetes care, food allergies, G-tube feedings, oxygen therapy, seizure management, urinary catheterization. Right now, we're kind of just fine-tuning it all. I hope to get those to you for review and approval in our July meeting, okay? So that'll be a pack of papers. We're also reviewing procedures related to field trips, which actually one of our, we do have a policy associated with it, so we may be revising that, but we just had the big trips, FPS big trips, the Florida trips from both Ward and Ludlow High. Ludlow High had a Paris trip as well. I really haven't heard I was concerned when they were planning it earlier in April and March. There were certainly, riots all over Paris. I spoke to the nurses today. They hadn't gotten a debriefing on it. But what we're trying to do is just make communication between the school staff, nurses, parents, and the students. I mean, these are high school kids, so they're part of it. We just don't do it for them. Just to make communication a lot more comprehensive so that we can really plan for whatever medical emergencies that may arise. Not even emergency, medical concerns. And that's all I have to say.
Great. Thanks, Cheryl, very much. So were there any communications that anybody received that you want to talk about?
We have none.
Any old business to discuss?
We have none.
Is there any other new business?
None on the agenda, no.
None. Any comments? No comments. Good. So, I guess we're done. So, can I have a motion to adjourn? We are adjourned.
Marvelous.
All right. Thanks, everyone.
Thank you.
Very much.
Recording now.
Thank you.